Hello, I'm Martin Caldwell, and today we are talking about Astrana Health and its acquisition for Prospect Health for $708 million. I think with that $708 million, they could have increased their training more for their physicians. They could have paid off debt. They could have done R&D. They could have had another acquisition that was not as costly. But to see if the expected present value of synergies exceed the opportunity cost, I think we need to look at a few things. And the first being is that their agreement is to pay off this acquisition 5 years from now. And from the article that we read, $13.5 million averaging is acquired annually from this acquisition. Now, after 5 years, that'll be $67.5 million in synergies, which isn't $708 million, but it's a something at least. Now, if you look at their section 20 in their 10K, Astrana Health, you'll find that they have 3 segments. Care Partners, their most revenue. Care Enablement, the middle, the second one. And then Care Delivery, their third and least revenue making segment. Now, if you look at Prospective Health, Care Delivery is what they specialize in. That's what they boast themselves about. So I think this is Astrana Health's way of boosting that segment. I think it also needs to be said that in the article it said that this Prospective Health will boost revenue by 1.2 billion, and last year 2024 Astrana Health made 1.8 billion in revenue. So that'll be a substantial boost in revenue, which doesn't always equate to it being great. So let's keep looking. Sunk costs are it's the merger. They've already done it. That's going to happen. That has already happened. But then hidden cost, I think we need to look at Prospective's Health. What was happening in January with Prospective Health? Prospective Health, this year of January, they filed a Chapter 11 bankruptcy, which is just a debt refinancing, and it's a non-taxable event. But that means with this acquisition, Astrana Health is going to have to pay off their debt that they already had, because they didn't liquidate and they hadn't paid it off yet. I think another hidden cost is because of this bankruptcy, they're going to need new management. New management because their old management had bad leasebacks and other medical revenue cycles that were not good and kind of led to over acquisition of debt. Now, I think this means that the present value of synergies does not exceed the opportunity cost. But I think the overall expansion of Astrana Health, it is a worthwhile investment for Astrana Health to boost their segment, to boost their revenue, to be in new locations such as like Pennsylvania, and to expand their reach to farther than just Southern California and Texas.